LIGHT is a 6-year cross-disciplinary global health research programme funded by UK Aid, led by LSTM in collaboration with partners in Kenya, Malawi, Nigeria, Uganda and the UK. LIGHT aims to support policy and practice in transforming gendered pathways to health for people with TB in urban settings. This will lead to enhanced overall health and well-being, improved socio-economic outcomes, equity, and help prevent the spread of TB. What is the problem that your research is addressing?
In Malawi, 26,000 people have developed tuberculosis in 2021. Most of these people were men. If not tested and treated, people with tuberculosis can transmit to others, become sick themselves, and die. Men delay care seeking for tuberculosis. Finding and treating people with tuberculosis but have not been tested is very important to prevent them from transmitting to others. However, it is unclear how much TB can be prevented by finding and treating men with undiagnosed TB. Answering this question is very important for policy and decision makers to justify dedicating resources towards finding and treating men with undiagnosed TB within their communities.
What are you planning to do?
My name is Mphatso Phiri. I'm a medical doctor by training and an early career researcher in the LIGHT program. I'm based at the Malawi Liverpool Wellcome Clinical Research Program, and I'm also affiliated with the Kamuzu University of Health Sciences, formerly called University of Malawi College of Medicine. My research aims to understand how much TB can be prevented among men, women, and children by approaches that prioritize finding and treating men with untreated TB. I'm also conducting a survey to measure the number of people who have been previously exposed to TB-causing organisms in Blantyre, Malawi. Findings from this survey will inform design of sex-targeted interventions to prevent exposure to TB infection or progression to disease if we find the risk of infection to differ by sex in these communities.
How are you planning to maximize the impact of your research?
I work very closely with the Malawi National TB and Leprosy Elimination Program and the Department of Gender Affairs, with various stakeholders working in TB care in Malawi. This ensures that my research is informed by the priorities of all stakeholders working in TB care, particularly how to improve access to TB testing, care and treatment for men to prevent transmission towards other men, women and children.
How does this research fit within the overall aim of the LIGHT Consortium?
My research is just one project within the overall research program. There are other research projects going on in Kenya, Nigeria and Uganda, also looking to increase male access to TB care services. LIGHT provides a platform for scale-up of effective TB interventions through cross-country learning, community-based studies, and health facility-based studies, and working closely in partnership with TB-affected communities to co-produce solutions with them.
How will this impact your career in the future?
This current research, knowledge and skills, and networks that I'm building will help me develop into an excellent researcher working on evaluating the impact of interventions to combat the impact of TB in Africa, especially in vulnerable groups, for example, men. So join me in the fight to end TB. Thank you for listening. that wasn't supposed to be part of it.